Riedel, and this is my musculoskeletal assessment. So to start off, I'm going to knock and enter the patient's room. I'm going to close the door, the curtain, to give him his privacy, and ask him to verify his name and date of birth.
Adam Riedel, April 4th, 1991.
Perfect. So I'm going to perform my hand hygiene, and while I'm doing this, I'm going to kind of explain what we're doing today. So I am going to do a head-to-toe musculoskeletal assessment on you. So I'm going to palpate, check your strength and your range of motion. Perfect. And we're going to start with your temporal mandibular joint here.
Okay.
Okay, so go ahead. So I'm just going to palpate, make sure there's no redness, swelling. I'm going to go ahead and have you open your mouth, close your mouth, and move your jaw side to side. Yeah. And then in and out. Perfect. Does that feel okay?
Uh-huh.
Okay. Now we're going to move to your C-spine. So I'm going to have you put your head down. Perfect. And I'm just going to check your spinal process. And C7 should be the protruding one. It's pretty protruding. Okay. Any pain?
Mm-mm.
Good. No redness, no swelling. That looks normal. Okay. Go ahead and lift your head up. Now I'm going to go ahead and have you lift your head all the way to the sky and then back down. Perfect. And then just up normal. And I'm going to have you go side to side. Perfect. Any pain?
Mm-mm.
Good. Okay, now ear to shoulder. Good. Does that feel okay?
Mm-hmm.
Perfect. Okay, now I'm going to go ahead and have you stand on up, and we're just going to do the upper arms and shoulder area here.
Okay.
So I'm going to have you make a rainbow. Perfect, behind your head. Awesome, and back down. Okay, go ahead and lift your arms up, all the way up, and then all the way back down. And go ahead and put them behind your... Okay, go ahead and relax. Now I'm just going to check your shoulders here and inspect them, make sure nothing is out of whack. Any pain?
Mm-mm.
Perfect, and they look pretty aligned here. I just want to make sure I check that too. Okay, now we're going to go ahead and move down to your elbows here. So I'm just going to fold down here. Okay. And go ahead and shrug your shoulders up for me. Perfect, and back down. So that's normal. Good. Okay, and perfect. Any pain?
Mm-mm.
Good. Okay, now we're going to check your elbows and wrist here. So I'm going to have you flex up, flex down, and then flex halfway up. Good. And I'm going to go ahead and check your strength here. So pull up. Perfect. And I'm going to check the strength. Pull up. Good. Okay. Now go back here, and we're going to check your wrist and your hands. So I'm going to have you open your hands and turn them over, and then flex them down, and then flex them back all the way up. Good. Spread your fingers for me. Put them back together, and then put them back down. Okay, now I'm just going to have you drop the fingers, so don't move the wrist. Okay, and then lift the fingers back up. Good. Does that feel okay?
Mm-hmm.
Perfect. Okay, now I'm going to go ahead and have you turn them back over, and I'm going to check your strength here of your hands here. They're going to just curl your fingers for me and kind of grab me. Cool. Let me feel this one. Perfect. Okay, now let me just palpate and inspect your hands here. There's a lot of little bones in here, so we just want to make sure there's no fractures or any pain anywhere. So it's important to check. Any pain? Nope. Okay, let me just check your fingers for any nodules. Especially people with arthritis will have nodules. So definitely check that out. Okay, let me move to this one. Perfect. Any pain?
No, maybe.
Good. Let me just check your fingers here. Good. Okay, now I'm going to go ahead and have you lay on down for me. Let me just grab this chair. Perfect. Awesome. Are you comfortable?
Mm-hmm.
Okay, you can relax your head. Perfect. Okay, I'm just going to check your hips right here. Kind of your pelvis area. Does that feel okay?
Uh-huh.
Got it. Okay, now we're going to check your legs here. So I'm going to have you lift this leg straight up. Is that okay?
Uh-huh.
Back down. Okay, go ahead and lift your knee. Perfect. And then turn it in. Perfect. And then out. Yeah. Does that feel okay?
Yes.
Okay, back down. Now I'm going to have you move your leg out like that. don't grab your knee. Good. And then go ahead and push on me. Okay, and then abduct. Good. Feels good. Are you feeling okay?
Yeah.
Perfect. Okay, let's do the other side here. And I'm going to have you raise your leg up. Does that feel okay? Is that hurting your lower back at all?
No.
Okay. Back down and go ahead and bend the knee for me. Perfect. Rotate in. Rotate out. Good. Okay, straighten that leg back out. And I'm going to have you abduct it. Perfect. And then put it back in. Okay, now I'm going to check your strength, so try to push on me. Okay, and then pull me in. Good. That feels pretty good. Now, before we go to the knees, we're going to assess the ankles and the feet because I have them in the right position. So put your feet just straight, normal. Perfect. Okay, and I'm just going to palpate and inspect your ankles. And just like the hands, the feet have a bunch of bones, so we want to just palpate everywhere, make sure the patient doesn't have any pain. Any pain?
No, ma'am.
Awesome. And then we're going to just also kind of check for any ulcers. Perfect. And nodules on the toes. So that feels pretty good. Awesome. We'll do this side and inspect that. Any pain?
No.
Good. Let me just check for any nodules or ulcers that aren't healing, especially with diabetics. Perfect. That looks pretty good. Okay, now I'm going to have you sit on up and you can lower your knees. You need help getting up?
No.
Got it. Okay. Now I'm going to start with this knee here. So it's pretty common to have knee issues, especially in athletic men. Have you had any knee issues?
Yeah, I have a pretty big bone that protrudes out of here, but it doesn't have any pain.
Okay. How long has that been there?
Oh gosh, since like 7th grade.
Okay. Okay. Any pain?
No.
Good. Okay, so I'm going to have you go ahead and flex this leg up. Okay. Perfect. And then I'm going to go ahead and check your strength here. So push out on me. Okay, now pull back in. Good. Okay, let's check this one. So this is the Oshkin-Slaughters on your knee right here?
Yeah.
Okay. It's been there since 7th grade.
Uh-huh.
Okay, any pain?
No.
Okay, let me just check your strength here. Go ahead, or before I check your strength, let's just have you lift your knee up and back down. Perfect. Now let me check your strength. Go ahead and push on me. Awesome. And then pull me back in here. Good. Okay, you can go ahead and stand on up. And I'm going to have you put a hand just right here to support you so you don't fall. And I'm going to start with the right leg. So lift up and out. And then pull it back down and flex. Good. Now do it with the other leg. Up, out, and flex. Does that feel okay?
Mm-hmm.
Good. Okay. Now let's check the C-spine here, or the thoracic spine and lumbar spine. So to start off with, I'm just going to have him stand straight to the side. So we want to see a nice curve here, which looks pretty good. So the thoracic spine should be out more. And I'm going to kind of just palpitate, kind of feel this. And most of the time we would do this with the shirt off or the gown open to the back so we can kind of see it a little bit better. Any pain?
No.
Okay. And you feel pretty aligned here, which is good. And your hips feel pretty aligned too. Okay, I'm going to have you go ahead and bend forward. Perfect. And you want to see the C and make sure everything's aligned. Any pain?
No.
Good. Okay, you can go ahead and put that back up. Now we're going to check, have you put your hands on your hip here. And I'm going to have you just go side to side. Yeah. Okay, now without rotating your hips, I'm going to have you just rotate side to side. Yeah, like that. Perfect. Any pain with that?
Nope.
Does that feel okay?
Yeah.
Good. Okay, awesome. Well, you seem pretty good. Everything seemed pretty normal. So I'm going to go ahead and do my hand hygiene and get you into a comfortable position.
I will sit, ma'am.
For the doctor to come in, or just to go back to charting everything. So I'm going to document everything's normal and go from there. Thank you.